You know, we are mental health professionals, so this is not going to be a surprise to us. A lot of the risk factors, if you think about them in reverse, they're going to be our protective factors, right? So if you think about childhood aggression, lack of parental supervision, poor social skills, early drug experimentation, living in environments where there is an availability of drugs at school. We know kids are also finding drugs at home these days in their medicine cabinets. Poverty is related to addiction. However, addiction is not the cause. I think we definitely want to have from a social justice perspective, we have to understand that, poverty has been there much before any addiction or substance use, right? So what are some protective factors that we look at? We look at addiction. First and foremost, can it be treated? What are some stages of recovery and treatment? What is the role of medication? And what is the role of psychotherapy? So I hope that you'll be excited to discuss these questions with me. Oh, another great question, sorry, here that I just saw and I love is this idea of substance addictions, behavioral addictions, essentially like sex addiction and gaming, for example, and how they work on the reward circuitry. A lot of this is yet to be demonstrated. A lot of it has yet to be studied and demonstrated. So we don't really know right now. What we know is that essentially the DSM is not giving us it's not putting me in kind of medication slide, and I want to spend some time, obviously, on Suboxone, buprenorphine. But basically, for opioid use disorders, we have several options. We have an agonist drug, that's methadone. It functions like other opioid agonists, like heroin or fentanyl even, but is very different from those drugs in that it doesn't spike. Oftentimes, a real spike in the opioid concentration, the binding of the opioids in the brain is what causes the high. Methadone doesn't give people a really good high. It's like a really boring drug. It doesn't really spike fast. So it's a safer way to keep people on opioids and, minimizing the risk of the high. But you still can't give much of it, when you think about the opioid, the methadone programs, you give smaller amounts still because there is a risk that you can crush it, that you can how do we get here? Let's start with that. Well, one of the ways in which you got here is by having liberal prescription practices with opioids. So basically, the idea is that physicians started asking more and more about pain because pain became, a vital sign. So when you go to your doctor, you have the smiley faces and the sad looking faces that help you grade your pain. That's what we're doing. That's what our patients are doing. And when you report some pain, then, physicians want to address that pain. A lot of physicians were under the, impression that using medications such as Percocet, was safe and did not have a high abuse liability. Well, what we found is that that's absolutely